you ready to master the waves of medical device product development? Well, wax up your surfboard because you are listening to Inspired by Imua. And here is your medical device product development expert, that Hawaiian-hearted hostess who will help you hang 10, Meghan Alonso.
And aloha! You're listening to Inspired by Imua, where we help you master the waves of medical product development. Each week, we interview guests that educate, guide, and inspire to give you and your product the skills you need to hang 10. If this is your first time listening, Imua is spelled I-M-U-A, and it's a Hawaiian word. It means to advance forward with passion despite rough waves. There are plenty of those in medical device development, but keep listening because we've got you covered. This episode is sponsored by audible.com, and you can head on over to imua-services.com/free book to grab your copy of a free audiobook that you can listen to on your cell phone. You can also be a part of our monthly book club. This month, we're listening to and reading The Lean Startup by Eric Ries. Also, we are sponsored by Device Talks. Next week, June 26th through the 27th, join us in St. Paul, Minnesota for great content around the leading medical device companies, all about medical product development, networking. The food is spectacular at these events, and Brian Johnson of Mass Device definitely delivers every time. I always enjoy this conference, and I go back every year. So if you use promo code Imua at checkout, you can save 20% and you can register by heading over to devicetalks.com. Hope to see you there. So I'm not going to lie, this episode is definitely one of my favorites. I think the one with my dad was my most favorite. That's episode 17, by the way. But anyway, my guest today has had multiple brain surgeries. He's had MRSA inside of his head. He had a tumor the size of a tennis ball inside of his head. And the really cool thing is that he works in our industry. He's around innovative products every day. And he was able to use some of the products that his company produces in his last surgery, which was actually just a few weeks ago. So I want you to listen to the story. I want you to get inspired. And no matter what you do, if you're an engineer, if you're on the business side, if you work in marketing, if you're a scientist, the work you do matters. And that needs to be recognized. You need to give yourself a pat on the back because guys like my guest today are alive because of you. And you can check out our show notes page. Just head on over to imua-services.com and you can click the podcast tab. There's some amazing pictures from his surgery. So without further ado, please help me welcome Aaron Jennings. Aaron, are you ready to hang 10?
Certainly am.
All right. So we did an intro here, but give more of a glimpse into your personal life. What is it? Not only are you a patient of medical devices and medical products, but you work in the industry. What kind of drove you to work in the industry to begin with?
To be honest, I didn't really know about the industry at the time. I was in college with a good friend of mine, Eric Bean, and we just met this guy at the gym, and he's like, "Hey, you guys want to be in medical sales?" And we're both like, "Yeah, sure." And this was when we were in our mid-20s, and we did really well. And actually, my friend Eric is still with the same company back in Florida. I ended up moving over to the West Coast in 2008. With the same company, just a different distributor, and really glad I did. You know, my girlfriend at the time moved out, and we ended up getting married, buying a house, having kids, and started a distributorship, and just had some good doctors, good companies. I really enjoyed it. It's kind of helped me feel more comfortable with the process that I've been through with my brain surgeries that I've had recently too.
Mm-hmm. That's good. And you have a wife, as you mentioned. You have two kids.
Two beautiful kids, crazy kids. They're a handful, but every day's a blessing.
Yeah. So how has it been managing, your work life and your personal life and just being a husband and a dad with all of this going on?
Well, luckily I have a good support staff, both professionally and personally. My wife is incredible, holds this house together, and does such a great job with the kids and the house and everything. And then the people I work, I'm lucky enough to surround myself with really good people in both realms. And professionally, I just, the people I work for, the people I work with, they're all incredible. And luckily, the people I work with have been able to pull some strings and get me in front of some really, really talented doctors for myself. So feel very fortunate.
Yeah, that's good. You can leverage that. So that gets me into this story to begin with. So describe what you just went through, your latest surgery, and then what's been that story with your brain surgeries.
So to describe what I recently went through, I might have to touch on what I've been through in the past.
Sure.
So let's see. Back in 2012, I was having some symptoms of headaches and vomiting, and a couple of my really close friends out here are neurosurgeons. They're like, just go get an MRI and we'll read it. I ended up having a tennis ball sized tumor in my brain.
Whoa.
So they, luckily, one of my neurosurgeon friends did his residency under Dr. Stephen Giannotta, who's world-renowned tumor guy at USC Keck. And he basically called Dr. G on his cell phone and said, I need you to do me a favor. So the next day, Dr. Giannotta removed the tumor after his clinic. It was, we were there pretty late. I'm so grateful for him. And, I did my follow-up MRIs and everything looked good. But then all of a sudden, between my 1-year follow-up and my 2-year follow-up, this tumor grew back at a rapid pace, which is unusual for benign meningioma. Grade 1 is what they determined. So last year in February, they took it out again, everything they could get. And then they had to I did what's called IMRT radiation, which is it's a kind of, they also call it fractionated radiation, which is low doses of radiation over a longer period of time. So I did 30 days of that, which kind of damaged the tissue a little bit, which is a common side effect. And I got an infection. I got MRSA in my head, which is
my gosh,
pretty scary.
So just to clarify, a benign. How did you say meningioma?
Benign meningioma. So basically, it's not cancerous.
And it's a tumor of the meninges in your brain, then.
Maybe.
I think so. I'm guessing because I remember the anatomy and the meninges are a portion. So I'm assuming that's where it was located. Wow, and a tennis ball size.
Yeah, it's pretty. And I always joke because it's kind of embarrassing that much space in my brain was just doing nothing for so long. A lot. But anyway, so they had to wash out the MRSA, and that's where I came into this new situation where they removed the bone flap that I used to have. So I was basically, for a 12-month period, I was walking around with an unprotected part of my skull. And because of my...
Oh, so the scalp and the hair was covering it, but it was just really...
So it looked like I got hit with a baseball bat.
Yeah.
I basically had a big dent in the side of my head, but I rocked it. I did it for a year. It's kind of weird not having it, but weird in a good way, I guess you can say. So so they removed everything that was infected, washed it out. I did a vancomycin PICC line, which was pretty hard, but I got through it. And so I'm sitting here like looking at the plate options, and the typical plate options for a situation like myself is either PEEK, which is a polyether ether ketone plastic, basically, or titanium mesh, which is probably the most commonly used. PEEK is relatively new, but both are compatible in the body, but both are really not liked by the body. Like if you get an infection on either one of those, the body's not going to grow through it and fight it. And you're not going to have any blood flow in the middle of a plastic plate. So at NASS, which is a big spine meeting in October of last year.
National Association of Spinal something, right? Not something, but not officially. But I forgot what the other S is.
It's the largest meeting for this industry for spine and neuro and all that stuff of the year, and it was in Boston last year, October. So through a friend of mine or a colleague of mine, I met Paul Byerly, who's the national distributor for OsDesign, which is this new plate that at the time did not have FDA approval, but I sat down with him, got to know him. He actually lives near me over here in Southern California. And I was like, listen, Paul, I think your plate would be perfect for me. And I'll explain why in a second, but it's not approved. So, just let me know when you get it approved and hopefully the timeline works out. So I was planning on getting a PEEK plate, but hopefully Paul came through, and they did. They got FDA approval in January. And he called me. He's like, great news. We got approval. Let's make this happen. So we got the plate in time, and we got it in the hospital in time. And everyone at the USC was really helpful. And It was great. And the reason this plate is so good for me is because it has the ability to vascularize with the body because of what it's made out of, titanium mesh with calcium phosphate tiles. It allows the body to grow in through it. So hypothetically, if I would get an infection on the plate, the theory is that the body would be able to fight it because there's vascularization at all sites of the plate.
Huh, that's interesting. And I like it. It's kind of, I've seen a little bit of that technology in orthopedic implants where they make it so it's porous and the tissue grows into it.
Yeah, like the consistency of bone, like the big push for titanium.
Yeah.
Yeah. And there's a couple of good companies out there that do that really well.
Yeah. Wow, that's awesome. And before the interview, we were talking offline about how you were able to use the company that you work for, you were able to use some of their products for yourself, which what better way to sell this? You definitely need to be a company spokesperson, and they could make a video. So tell us more about that, since our listeners missed that.
Better looking, they probably asked me to be the spokesman, but so First Biologics is an incredible company. One of the products that I got, it's not their flagship product, but it is a very popular product. It's called an amniotic membrane. And as a distributor, I sold a lot of these, especially for protecting the neural elements. And it was actually pretty interesting. I went into the surgery thinking that we could use it as an adhesion barrier on the dura, which protects the brain, keep it from any kind of scar tissue that would adhere from the plate or through the plate or whatever. But my chief of plastic surgery, Dr. Alex Wong, brilliant guy. And I'm kind of embarrassed because I've literally been selling this type of product for 5 years, and I never really thought of this as an application. He put it over the plate and under my incision, so the growth factors from the tissue could help in the incision, and the membrane would prevent scarring. So I thought that was an incredible application. Kind of embarrassed I didn't think about it, but my CEO of Burst Biologics, Chris Jones, was kind enough to donate a tissue for me. It's a good friend of mine, longtime friend of mine, so that was really nice of him.
Well, like I said, it definitely helps with the sales process.
I'm a walking billboard. No, I swear it's underneath the skin somewhere.
Yeah, and that's the cool thing about innovation is being able to see from a technical side, okay, our skill set over here is in the technical side, and then you marry that with the physician or the healthcare provider on the application side and able to pinpoint that. One of the coolest opportunities I had hip surgery. It's been 4 years now, a little over 4 years. And I flew to Vail, Colorado, and I had it done at the Stedman Clinic there. And I saw the pioneer of arthroscopic hip surgery. That's why I specifically went there. And they have this whole research institute where they test new surgical techniques. And I got to tour it, and I was like a kid in a candy store, and they were testing different PCL repair techniques. So posterior cruciate ligament. And they just tested it injured, and they had it on a machine that was doing flexion and extension.
Yeah.
And then they would surgically repair it one way, and then they would put it on the machine, and then they would take out the stitches and then repair it another way and then put it back and just compare it. And that's so cool to me, just to see what the other side and what these physicians are doing with the product. So it's a really important part of innovation later on to have those ties with the key opinion leaders and the clinicians that are going to be able to promote the products too.
Yeah. You mentioned earlier, you asked me offline about if I met the person that innovated this product. And I actually have at AANS, which is another spine meeting in LA. So this was after we started building the plate, when we realized we're going to get it done, which happened really quickly, by the way, once they started. And I got to meet the entire staff was from Sweden, and they were exhibiting at the show. I got to meet the founder of the company, the inventor of the product, the whole market. It was incredible, and it was cool. I feel very proud to be their number one, like their first patient in the U.S. to get this technology. And I know they're working on a bunch more after me, but I'm happy to take the first one.
Yeah. Yeah, that's incredible. And it's such a good feeling. You have such a unique connection with them now.
Yeah, you're right. There's kind of like a little bit of a bond there that you kind of maybe didn't expect, but are happy to have after the fact.
Mm-hmm. So I have this question in my list for later, but since we're here right now and it's on topic, so now after going through the surgery and having the product, and it might be too early because didn't you say you're as of this recording you're 2.5 weeks post-op?
Just about 2.5 weeks, yeah.
Okay. So is there anything right now that you would say to them, or just about the whole process and how your body's handling the product, or is it just too early to tell for now?
It's too early to tell how my body's handling it. However, it's a 3D printed type of technology. So it's custom plate.
Wow.
And I'm kind of blown away by how, well, the shape of my head wasn't exactly on point to begin with, but they really did a great job of mimicking the other side. So it looks right. It looks right, I guess.
Yeah, that's good.
But so the way they designed the plate, it's perfect. And it's pretty incredible how they can do that with all their technology that they have. So I was pretty impressed by that. But it'll probably take over a year to go through it and vascularize. And actually, I was talking to Paul about this, and it would be cool to get like maybe an ultrasound to see the blood flow through the plate, and like a couple years out just to see how well it worked.
Yeah, that's true. So they're utilizing 3D printing for manufacturing. And,
well, yeah.
Several people have this misconception of, oh, it's so easy now. You don't even have to scale your product anymore. And so I want to use this as a teaching point to something like this is obviously very customized, and it's a very expensive product because it's made exactly for you. So that makes sense when it's utilizing 3D printing for manufacturing. Where a lot of people don't understand is you can't use 3D printing for something if it's going to be a high volume product. So someone is getting, you're making
like something that you need a bunch of sizes for.
Yes. Yeah. Or like you're going to make 1 million of these each year, or even 100,000 a year.
Yeah. No, you're totally right. Like it's just in like the time frame of it all. Like if you I'll give the example of a pedicle screw tray. Like there's probably 60 different screws in a pedicle screw tray. You can't just, you need a 4.5 by 47. Okay, so give me like 3 weeks and I'll print it for you when the patient's on the table.
Yeah, it just has to be right there, ready to go.
But in this case, for like cranie plates, I think it's incredible because there are a bunch of different cases that have different sizes, and you have the ability to plan ahead and get that perfect plate made for the surgery. I mean, we all knew going into this that I would have 12 months of downtime to make sure the infection didn't come back. So we used a portion of that time frame to build this plate for myself. And you're right, it's based on certain limitations, but when everything lines up and the technology's there, it's incredible.
Yeah, and it's the time to make it, the resin and the material that goes into it is very expensive. So it's not a scalable method, but for something like this, it's the perfect fit.
I agree. Yeah.
Yeah. So what's something you didn't expect about this? Or again, maybe that's too early to ask that.
Didn't expect. I didn't expect to get so much support from the company. That's usually not so typical, but I'm very thankful for it. It was really nice to be able to be in direct communication with not only the national distributor, but people at corporate if I needed to. It's not necessary, but it was, just an added benefit.
Yeah. And do you think that was because of your professional connections, being in the field and working in the field, or that you're their first patient, or maybe it's both?
Yeah, I think it's a combination of both, but it was really nice. And one thing that was cool, and this is probably leaning on the fact that I have a relationship with Paul now based on my connections in the industry. He was kind of excited about it too. So we were sharing cool stuff. He was like, hey, I got your CAD designs today. Do you want to see them? I'm like, yeah.
Oh, fun. Uh-huh.
So what they do is like they'll take the CT of my head and then put the image, like 3D, create it in a CAD format, and then they'll measure out the plate and how they need to make it. So I have multiple images on my phone now that are really fun to show people of my actual skull printed on a computer, and then with and without the plate, different angles with the plate in, and it's pretty cool.
Wow. So if you're okay with this, I would love to get some of those pictures and I'll put it on the website with this podcast so people can see that. I've
got a couple that I would love to share with you. And I also have a couple that I'd also love to share with you, but they're kind of gruesome. My platform has been so awesome. I told him, I'm like, I really want pictures during this surgery. They were going to video it, but someone dropped the ball at the hospital where they didn't get my consent. But I was telling everyone before and I'm like, I want video on video. So, but my lead doc took some pictures before and after the plate was in, and they're incredible. There was a small shot of that on that LinkedIn post of the plate actually in my head. But I just thought so now I joke that I tell my friends that I have proof that I have a brain now because my doctor took a picture of it.
Oh. So. Yeah. Did you go through any rehab, or you just, you had the surgery and then you woke up and you're fine? It's just kind of like resting.
Well, yeah, I mean, like there are certain things you have to do to get released from the hospital, like occupational therapy, physical therapy, but they're basically like questions. The occupational therapy is a series of questions. The physical therapy is basically, can you stand up? Can you sit down? Can you show resistance on your legs?
Yeah.
Can you walk around? Can you go upstairs? Basically, like getting around the house. They'll ask you, they'll be like, do you have stairs in your house? Yes, I do. Okay, let's go do some stairs. But I've done this is my fifth surgery, fourth, well, yeah, kind of like my fifth surgery. So I'm really familiar with what I need to do to get out of the hospital. Yeah. So, but now that I'm out of the hospital, the first week was basically just resting, which is hard for me to do because I'm an active person and like I like to be productive and feel active. But it's hard to focus on things, especially with the anti-seizure drug Keppra post-op. But my wife's been instrumental in allowing me to rest and not keeping me from feeling too bad because she's been just taking over full force with the kids.
Yeah. So the anti-seizure medication, is that you just on that temporarily?
Yeah. Well, it's standard procedure, right? So if you go in, around, or near the brain, they want you on Keppra afterwards. I have no risk of seizures myself, but it's just precautionary. I've taken it every time for every surgery. So I recently finished, which is great because it kind of drains you energy wise. So I finished that on Wednesday. So I feel like Thursday, Friday, today, tomorrow, like every day is just going to get better and better. But I feel great. Like I said earlier, I've been out in the field this week, been really successful. So it's kind of gotten my spirits back up. Not that they were ever really down, but it feels good. Feels good to be back to my own self.
Yeah. So I had a question to ask you, which may not be relevant since you have had so many surgeries, but is your view on healthcare innovation different now that you've had this, or you've just gone through it so much that you're just kind of jaded?
It's a great question because I come from an industry that is spine, that there's some innovation, but not as much as in other areas is what I've learned. So there's two things that kind of blew my mind in terms of innovation. The first of which through this experience was when I got my radiation treatment at Norris Cancer Building at USC. I was just blown away by the machine that did my fractionated radiation. I couldn't believe it. It was just so big and advanced, and I was really, really impressed by that. And of course, I went in there 30 times in a matter of 6 weeks, and every time I went in there, I'd ask the techs questions about the machine because I was just so fascinated. And then also this plate has been a pretty incredible blessing for me because it just fits my profile perfectly. There's two things that could really hurt me, and that's if the infection comes back or the tumor comes back. So the radiation hopefully killed the tumor, and the infection seems to be gone. But if it comes back, I have a better chance at life and fighting this infection if I have the plate that I have from Austin Design. So I'm very grateful for that.
Mm-hmm. Yeah. Yeah. It seems like the spinal industry, you're right. I don't see as much innovation directly there, but then the biologics around all the spinal surgeries that I think are incredible.
Yeah, biologics is definitely innovative right now. I feel very fortunate to work for the company I do because they have something that is cutting edge. They're first to market with. Nobody can really compare to it. But yeah, biologics is incredible. And it's not just the one thing that I really like about the position I'm in now is I'm not just working with spine surgeons anymore. I'm working with all kinds of doctors, sports medicine, pain management, plastic surgery, orthopedic. I mean, there's just so many unreal applications for these types of products. So my network has grown tremendously since I started this new position.
Yeah, that's true. That's a good point. So now that you're on the patient side, what would you give? So you've got to put on like the patient side of your brain and the professional side of your brain.
I don't have a side now. No, I'm just kidding.
Well, yeah. I mean, well, I guess
everything else out.
this question actually maybe you could pull it from both sides of your brain. So anyone just starting to work on a new medical product or thinking like, hey, I have this idea that I think I could really help people with this. Is there anything that you would say to them, just from your experience or something that you think would be helpful to them?
Yeah, I mean, well, you got to be different. You got to have something new. You maybe take what someone else is doing, improve upon it. But it's hard to be successful these days, I think, with Me Too products. Like, if you come out with a product that's similar or exactly the same as other products, it's hard to get market share unless you have like certain types of business models. But if you come out with a product that is maybe similar to other products, but it's better for multiple reasons, that's an incredibly powerful product to have. Mm-hmm. And like proving these outcomes, whether it's in vitro or in vivo, is pretty important because there's a lot of people out there that want to see proof. Someone once described the market to me as the 3-bucket series of where physicians fall into. So one being very innovative, 2 being they want to be innovative, but they want to see data, and 3 being I'm not going to touch any new technology without data, period. And you got to kind of figure out which bucket you're targeting with your products, because eventually all 3 buckets will get this technology. But if you want to have something new and innovative, you're going for the bucket 1 guys too, and it'll just trickle down from there.
Yeah, you bring up a really interesting piece of advice. And last year I was exposed to this theory called blue ocean strategy. And you have red ocean strategy where obviously like there's sharks in the water and it's bloody. Like everybody's trying to go after the same thing and it's cutthroat. And with blue ocean, you differentiate yourself. So you kind of list out your competitors and what their unique selling proposition is and some of the highlights. So the example, just for reference here, that we were talking about when I learned this last year was circuses. And if you look at the traditional circus model and then you compare it to what Cirque du Soleil has done. So you have like the circus, okay, the pricing has traditionally been very inexpensive, where Cirque du Soleil is very expensive. And then, you have, like popcorn and peanuts type things. For Cirque du Soleil, you have more like you can get alcohol and things like that. And focused on the animals, versus Cirque du Soleil is more focused on the performance aspect of it. And it's just it's in the similar realm, but it's just such a different product. And they've done a good job of really differentiating that.
Yeah, I mean, it's a very good point, especially for your question on, if there's any advice for someone that's coming out with new technology. You can people say that the medical device industry, the innovation aspect of it is going away because of the medical device tax. I don't know if I totally agree with that, because if you come up with something truly innovative, there are premiums that people will pay for these. Like a good example would be like one innovative product I feel like in spine recently, probably the only or of few, is expandable technology. Hospitals are paying less and less for products, but if you can have something like an expandable cage that really truly adds value to a procedure, there are premiums that can be had and are well deserved by the company, I believe.
Yeah. So for us not in orthopedics, tell us what an expandable cage is.
So traditional spinal surgery, there's a cage which is meant to restore disc height for a patient that may have degenerative disc disease. And there historically have been fixed, whether titanium or plastic, and they're meant to go into the space and restore the height, and the bone graft would go around it to fuse the two bones together. But there has been a few companies that have come out with some great technology where the cage goes into the disc space and actually expands within the discs. And it gives you the ability to insert a cage that's smaller and can easily get around the nerve roots into a space, and then expand that technology to restore disc height to be higher. It's pretty incredible technology. It's probably been out maybe a couple of years now, but there's a lot of companies that are kind of improving upon it that come out.
Yeah, that's awesome. Okay, well, it was awesome to have you on the show today, and I love these the most, where we get to see the benefits of what the patients get, and that's the reason we're in the industry that we're in, and it's so unique to be able to connect with patients, and they can say, "Hey, my life is better because of what you're doing." So
yeah, like I literally feel like I have a better chance at life because of this plate. I honestly do. Because, like the road that I've been through, I'm constantly paranoid about stuff. Oh, my eye's baggy. Is that an infection coming back? Like stuff like that. And the peace of mind that a plate like this, piece of technology like this can give someone like me, helps me enjoy time with my family on a daily basis, instead of being like, oh, what if this, what if that? I figured, well, if it comes back, at least I have a better chance of fighting it. And also, there's things you can do that were cool that I didn't mention earlier, that you can remove portions of the plate that like if they do get infected, instead of having to remove the entire plate. So I feel like I have a better shot at everything just because of this plate. Yeah.
Wow. All right. Well, thank you so much.
Yeah, it was a pleasure hanging 10 with you, Megan.
Always good to hang 10. Next time I come back to Southern California, I'll let you know, and we can actually hang 10 together.
I'm actually, that's one thing that I'm thrilled to do. And I think the target date is in August, is dunk my head in the ocean again and go surfing. Because
good. Yeah.
Obviously with 45 stitches in my head, it makes it a little challenging.
Yeah.
And the doctors probably wouldn't like it, especially because of all the sharks that are around here right now.
I know. That's crazy.
Yeah.
All right. Well, I will talk with you later.
Thanks, Megan. Bye.
Thanks. Well, I hope you guys are inspired by that interview, and just that you're more thankful. I definitely am. He's been through a lot, and he's definitely sharp as a tack talking to us, and he's got a lot to be thankful for, as do we. Go ahead, head on over to the show notes page. Again, it's just imua-services.com. You'll see the podcast tab. You can catch up with us there. Check out those pictures that we mentioned in the interview. And like before, if you're looking for a free audio book, you can get one from audible.com. Head on over to imua-services.com/free book. Also, don't forget your tickets to Device Talks. That's coming up next week, June 26th through the 27th in St. Paul, Minnesota. You can save 20% with promo code IMUA. And actually, there's a new option this year to just attend the dinner on Monday night, which is spectacular. So hope to see you there. Let me know if you're going to be there. And until the next episode, Imua.
Mahalo for joining us. If you're new to riding the waves of medical device product development, or if you've been in development for a while already, Inspired by Imua is here to surf with you. Want to be a master of the waves? Text HANG10, that's HANGTEN, to 44222. We'll send you the most common wipeouts companies make in product development so you can avoid them and reach master wave status. Again, that's HANG10 to 44222. We publish a new episode every Tuesday, so catch us at inspiredbyimua.com. Imua!